service. On June the 23rd, in Beijing, there are 7 new confirmed cases, 4 suspected cases, and 1 asymptomatic virus carrier since the outbreak of the virus in Xinfadi market. On June the 11th, the total confirmed cases in Beijing reached 257. All of them are in hospital, and we have 22 asymptomatic virus carrier under observation. After the outbreak in Xinfadi, the Municipal Party Committee and the government has taken that very seriously and quickly conducted close management on key areas, and trace and quarantine close contacts. A number of targeted measures have been taken. The epidemic that has a direct relationship with Xinfadi has been put under basic control, and initial progress has been made. At the same time, we have found the cluster cases at home and in organizations and sporadic cases in communities. So the situation in Beijing is still grave and complex. We should not loosen our alert. We will continue to act on the guidelines of General Secretary Xi Jinping and the requirement of the Party Central Committee and State Council, and pay attention to key links and areas, and do a good work on prevention, and conduct precision-based prevention so as to prevent the spread of the virus. Nucleic acid test is the first front line to screen asymptomatic virus carrier and ensure good prevention and control. We should further increase the efficiency of the test and expand its scale. For the people in medium and high-risk areas and the key groups such as those working in the catering and logistic industries, as well as patients, should all receive such tests. We should increase mixed test for low-risk areas and resume normal order for work and life. For key areas, we have to ensure that everyone, including individuals and organizations, will perform their own responsibilities in strengthen the reservation at fever clinics and the pre-diagnosis to prevent in-hospital infection and increase the management of farm product markets such as disinfection, cleaning, ventilation, and personal protection so as to prevent imported cases. The Dragon Boat Festival is a direct test for us. We must act on all the requirements to ensure normal order of work and life so that we will deliver a safe and healthy holiday. We should prevent the gathering of people during the holidays, and scenic spots and parks should exercise restriction on the passenger flow and reservation and staggering peaks. The scenic spots and libraries and museums and art galleries and other public places must put the passenger flow under 30%. For markets and retail places and catering businesses, they should conduct measurement of temperature and volume control and 1 meter social distance, such as ventilation and disinfection. The business entities should ensure their own prevention and control work. For the civil aviation, railway, and road inspection sites should also increase the inspection. For Beijing citizens, please do not leave Beijing unless it's highly necessary, and wear your masks, do good self-protection to protect our own home. Today, we have invited leaders of the Municipal Disciplinary Inspection Commission, Municipal Commerce Bureau, Municipal Health Commission, and the CDC, and experts of Beijing Ditang Hospital to be present at the press conference to release relevant information. I'd like to invite the speakers for this press conference. They are Li Haichao, Director General of Municipal Health Commission; Director General of Municipal Disciplinary Inspection Commission, Xiao Sa. Inspector Wang Hongchun of the Municipal Commerce Bureau. Ms. Pang Xinhuo, Deputy Director of the CDC in Beijing, and Wu Guan, Vice President of Ditan Hospital. Now I'd like to first invite Pang Xinhuo to brief you about the latest cases and the epidemiological investigation. Good afternoon, everyone. I'd like to brief you about the new confirmed cases on June the 23rd. On June 23rd, from 0 to 24 hours, we have increased the new confirmed cases by 7, 4 male, 3 for female, average age 49, the youngest 19, the oldest 74. According to where they live, 6 are in Fengtai, 1 in Daxing. We have completed the investigation on 6 confirmed cases. The other one is still under investigation. We'd like to give you the specific information. According to CDC of Fengtai District, case 1, male, 74. She lives in Huaxiang, Fengtai District, retired. On the 9th, he went shopping on Xinfadi Market. On 13th, after the close management of the neighborhood, she did not went out. Since the 18th, she felt all kinds of symptoms, such as vomiting, and did not relax the symptoms after taking medicine. On 22nd, she was sent to Tiantan Hospital by ambulance and was tested positive. On the 23rd, she was confirmed as ordinary case. Case 2, female, 56. She lives in Huaxiang, Fengtai District. No job. She is a close contact of a confirmed case. On 20th, she had a sore throat, and 4 days before that, she did not go out. On 22nd, she was sent to Fengtai, a hospital in Fengtai by ambulance and was tested positive. She was confirmed positive on 23rd, and this was a light case. Case 3, male, 37. He lives in Panjiamiao, Fengtai District. He's a salesman of the Xinfadi Market. After the closure of Xinfadi, he was put on quarantine at home. Since the 17th, he was sent to the designated observation facilities. He did not had contact with others and tested positive on 21st. And on 22nd, he was sent to a hospital in Fengtai and confirmed on 23rd. He is an ordinary case. Case 4, male, 52. He lives in Datun village of Fengtai District. He works at a noodle restaurant at B1 of Xinfadi Market. He's also business personnel of Xinfadi Market. Since the 17th, he has not worked and stayed at home for quarantine. On 21st, he had fever and was sent to a hospital in Fengtai by ambulance and was tested positive on 22nd and was confirmed on 23rd. This is a light case. Case 5, female, 58. She lives in Xinchun Erli community of Fengtai District, retired. Her husband is a confirmed case. On the 7th, he went shopping at B1 of Xinfadi Market. On 17th, she had fever, and the fever was not released after taking medicine. 4 days before developing the symptoms, she went with her husband to Fengtai Hospital and went to a number of supermarket and restaurant for shopping. She was sent to a hospital in Fengtai by ambulance on 21st and was tested positive on 22nd and was confirmed in 23rd. This was an ordinary case. According to Daxing CDC, case 6, male, 19. He lives at Lucheng West Road of Daxing district. He is a delivery personnel of a logistic company. He went shopping at Xinfadi on the 11th. Every day from 18th to 21st, he went to see his parents to Huaxiang district. And during that period, he went to Xiangxiang, Laotang, and other restaurants and went shopping in shops and had close contact with his parents and a girlfriend. He was tested positive on 22nd and was sent to a hospital in Daxing district by ambulance, confirmed on 23rd, and this is an ordinary case. I'd like to remind you that we are in a crucial moment of epidemic control. Unless highly necessary, please do not gather or have parties or dine out in groups. Please wear your mask when you're out and maintain social distancing of at least 1 meter and wash your hands frequently, especially after and before and after having meals and go to restaurants. And when you go from outside and may have a contact with contaminated items, please wash your hands with soaps or disinfectants. And please washing your hand. Please, before washing your hands, do not touch your eyes, mouth, and nose. And use napkins when coughing and sneeze. And please obey the order when you are staying at home and shoulder your own responsibility of prevention control. Thank you very much. Now I'd like to invite Mr. Lei Haichao, head of the Municipal Health Commission. Friends from the media, good afternoon. I'd like to take this opportunity to brief you about the progress and the situation of epidemic control. On June the 11th, after the outbreak, the municipal government has paid a lot of attention to that, and the two-tier of CDC have conducted epidemiological investigation in less than 1 day. According to the epidemiological study of the previous 2 cases, we found that the meat selling place of Xinfadi as a high-risk area, and this has saved us a lot of time. The municipal party and the government has set up a steering group to Fengtai district. On the 16th, the emergency response level was upgraded from 3 to 2. We continue to avoid imported cases and local transmission of virus, targeted response, and efficient handling of the cases. The most strict and most decisive measures have been taken to conduct science-based and targeted prevention control work so as to win the people's war on preventing and fighting the virus. We lose no time in reporting the information of the confirmed cases and the situation of the epidemic to other provinces, and released the requirement that people should not go outside Beijing unless highly necessary, and banning people from medium high risk areas from leaving Beijing, and we have set up a closely knit network of epidemic prevention control. 13 days have passed since the first case of the outbreak. Looking back at the past 2 weeks, of the 256 cases that we have found, we can sum up some experience. Apart from our daily release of the epidemiological investigation of the confirmed cases, I'd like to make a brief analysis and a summary. Well, in general, the speed of the spread of the virus is fast. In short term, there has been a large increase of cases. The first case appeared on the 11th, and on the 12th, 6. For 13th and 14th, every day, 36 cases. So when we found the cases have increased sharply. From the 11th to the 23rd, we have reported 256 confirmed cases in Beijing. We have analyzed the cases and made comparison with the epidemic in January and February. Since the discovery of the first and to the 100th cases, this time we spent 5 days. But in January, it took us 11 days. Cases with close relationship to Xinfadi market, 253, accounting for 98.8% of the total cases. The other 3 cases, we are still investigating on their epidemiological trace. With regard to the time of the cases discovery, in the first 4 days, 79 cases were confirmed, accounting for 31% of the total cases. From 15th to 19th, 126 cases were confirmed, accounting for 49%. From 20th to 23rd, 51 cases were confirmed, accounting for 20%. With regard to the time of developing symptoms for cases, the earliest case actually had symptoms on the 4th. Since the 11th, there's been an increase of number of cases with symptoms, and it went to a peak on the 13th. The symptoms were mainly developed from the 9th to the 15th, accounting for 61% of the total cases. All this information shows that at early stage, the increase of the number is fast, and the spread of the virus is fast. There may be ways such as human-to-human transmission and transmission from the same source. The people exposed to the virus before the closure of Xinfadi is on a decrease in terms of their cases. Second, with regard to geographical distribution, among all the districts, most of them are in Fengtai. It takes up 171 out of the 256, accounting for 66.8%. It is followed by Daxing, 48 cases, or 18.8%. And third is Haidian district, 6.3%. For other districts, Xicheng 6, Dongcheng 5, Fangshan 4, Mentougou 2, Chaoyang 2, Shidingshan, Tongzhou 1. Of all the confirmed cases, if we draw a circle centering on Xinfadi with a diameter of radiator of 5 and 10 kilometers, then we'd like to show you the result. For those who are within 5 kilometers of Xinfadi, 160 cases are distributed there, accounting for 63% of the total cases. Of the 10 kilometers radiator, 194 cases are found, accounting for 76% of the total cases. Of the 15 kilometers of the market, 238 or 93% of the cases are found. So in terms of spatial distribution, the cases are strongly connected with Xinfadi market. With regard to the features of gender and age, 144 are male, 112 are female. The ratio, gender ratio is 1.3 to 1. The youngest one is 1 year and 7 months. The oldest is 86 years of age. The average age, 42. We have analyzed the critical cases and serious cases. We found that there is a 10-year age difference with other cases. That is to say, those who are older are more susceptible to develop into serious cases. With regard to the seriousness of the epidemic so far, there are many ordinary cases, altogether 193, accounting for 75.4%. Then it is followed by light cases, 53, accounting for 20.7%. For critical and serious cases, 3. And heavy cases, 7. We compared that with the situation in the beginning of the year. By end of March, the reported cases in the mainland of China, according to their structure, the ordinary cases take up a high ratio, and the critical cases and serious cases takes up a relatively smaller proportion. And third, from community screening. If we look back, maybe you can remember that at the beginning of this year, we stressed the importance of the function of the fever clinic in discovering the cases. Early diagnosis and treatment. According to the early detection, early treatment requirement, early treatment, early reporting, early tracing, and early discovery have been heightened, especially on how to discover the cases at early stage to prevent wider spread of the virus in community. We have conducted strict medical observation of close contacts and launched a large-scale population NAT screening. This tool work has been highlighted and played its due role during our epidemic control work this time. In the past 13 days, in the way and the process of case discovery, and positive changes have taken place, because on the first and the second day, the cases were from the fever clinics, and even for the third day, And later, we have found more and more cases from close contacts. And we have found more and more people tested positive of the NAT. So the timing of case discovery has been improved. Of the current cases discovered, 137 cases were found through NAT, accounting for 53%. 81 cases were found at hospitals, or 32%. These are all early cases. Of the observation of close contacts, 38 were found. But I'd like to tell you the latest development in recent 2 days. In the recent 2 days, we have reported 20 cases. Of them, in hospitals, we found only 3, only 15%. From close contacts, 8, 40%. From NAT screening, 9, 45%. So, from the way of case discovery, you can find that the speed and efficiency of case discovery has been increased. This is significantly different from the way we discover cases in the beginning of this year. Second, I'd like to say something about the treatment and in-hospital infection prevention. First, we increase the ability of hospitals to take in cases. All the confirmed cases are in Ditang Hospital. In January and February this year, Beijing designated 3 hospitals. And this time, all the cases are treated in Ditang Hospital. And also, in early stage of the epidemic this year, some cases were treated at district level hospitals. But this time, we have concentrated all the cases in Ditang for better treatment, so that we can pool experts' resources to improve the clinical results. Ditang Hospital has provided all the beds and doctors and nurses at the headquarters. Now, they have 170 beds prepared. Now we have only 256 cases, so the potential for case acceptance is quite high. And second, we have pooled resources. We have organized 102 medical personnel to Ditang Hospital. Some of them participated in the medical treatment in Wuhan, Hubei province, and Xiaotangshan, and they are quite experienced, and they are trying their best to treat serious cases and cases in critical condition. And we have also pooled the expertise. Tong Zhaohui, Jiang Li, Liu Xingquan, and other doctors who have been to Wuhan have joined our expert team. They are doing daily inspection and check, as well as consultation. We have combined Western medicine with TCM, and we have taken reliable and stable treatment measures to provide individualized treatment and to be prepared for their development. And so currently, the situation of the critical cases are in stable condition. And yesterday, 4 serious cases have been changed to ordinary cases. Today, 1 case in critical condition has has been removed from the respiratory facilities, and he's under observation. This is a good news. In order to prevent cross-infection in hospital, we have lost no time increasing prevention and control in hospital. We ask all the hospital to do disinfection, and personal protection of medical personnel, and increased alert level. We have strengthened the management of fever clinic and screening of cases. All people who have fever should receive NAT, blood test, and imaging, and sampling stations are set up in places other than the fever clinics to prevent concentration of population and cross-infection. Now, we have leaders from the Municipal Inspection, Disciplinary Inspection Commission with regard to preventing in-hospital infection. We are working together with their team to ensure good result. And we have conducted investigation and supervision on 79 hospitals. Since yesterday, fever clinic personnel and NAT personnel moved to hotels to further prevent in-hospital cross-infection, and also help them to concentrate on the screening at the fever clinic and NAT. Thank you. Dr. Li Haitao. Now I invite Mr. Xiao Sa from the Municipal Discipline Inspection Commission to release the result on investigation into dereliction of duty during the epidemic prevention and control. On June the 15th, the Municipal Commission for Discipline Inspection released result of preliminary investigation handling of the dereliction of duty and negligence of relevant personnel in Fengtai District in the prevention control of COVID-19. After the notification, the investigation team continued its in-depth investigation since the start of the COVID-19. Fengtai District set up at the beginning of this year a special task force for Xinfadi to guide and supervise the implementation of epidemic prevention in Xinfadi market. Fengtai Huaxiang District established a local Xinfadi task force to dock up with the district special task force responsible for Xinfadi market epidemic prevention. As the competent department, Fengtai District Health Commission is responsible for organizing and directing district CDC to carry out environmental disinfection and other epidemic prevention work within its jurisdiction. We have found that when the situation is getting better, the relevant people who are responsible for the work have failed to work relentlessly or pay attention to the work, and they implement the work in a loose manner and fail to rise to the proper standards and relaxed the efforts in terms of the guidance and supervision, such as temperature, mask wearing, or reporting, correcting relevant problems to higher authorities. So they have seriously derelicted their duty and should be held responsible for the outbreak of the epidemic in Xinfadi. At the request of the Municipal Commission for Discipline Inspection, the Municipal Party Committee approved the decision to hold responsible personnel accountable. The Standing Committee of Fengtai District Committee decided to remove Jia Qi, a member of the party group, Deputy Director of the Fengtai District Market Supervision Administration, and the person in charge of the task force of Fengtai District Xinfadi from his party post and government post. Cao Cong, director and party member of Fengtai District Health Commission, was given serious warning and downgraded government position. Fengtai District Xinhuadi Township Deputy Head, Deputy Director of the Xinhua Huaxiang Office, Head of the Xinfadi Task Force, Yang Jingjun, was given serious warning within the party government post demotion. The Municipal Commission for Discipline Inspection will continue to supervise and inspect relevant work. Thank you. Thank you, Xiaosa, for your briefing. Now I invite Mr. Wang Hongchun from the Commercial Bureau to brief you about the market supply during the holiday season. Good afternoon, friends from the media. The Dragon Boat Festival holiday is approaching. In order to ensure healthy and safe holiday, according to the relevant arrangements of the Municipal Party Committee and the Municipal Government, the Municipal Bureau of Commerce issued a notice on prevention control of the epidemic in the commercial service industry during the Dragon Boat Festival and ensure the stable supplies of supply to do a good job in the prevention control during the festival holiday and take multiple measures to ensure market supply. First, the supply of vegetable continues to improve. The market volume of the 7 key wholesale market has increased and has remained above 13,000 tons for 3 consecutive days. 8 large supermarket chains continue to accelerate the transfer of goods, vegetable stocks, and sufficient supply. The Pinggu Mafang Beijing Vegetable and Fruit Transfer Station set up by the Living Material Support Group under the Joint Prevention Control Mechanism of the State Council was officially opened on March the 23rd. The vehicles can make an appointment in advance through the WeChat public account of Beijing Pinggu Mafang Beijing Vegetable and Fruit Transfer Station. With the full support of Shandong Provincial Department of Commerce and Shouguang Municipal Government, over 1,200 tons of vegetables coordinated by the Ministry of Commerce have been transported to Beijing. The All China Federation of Supply and Marketing Cooperatives set up an Emergency Supply Beijing Working Group to organize China Supply and Marketing Group, its affiliated enterprises, and Beijing Supply and Marketing Cooperatives to cooperate with supply and marketing cooperatives in Liaoning, Hebei, and Shandong provinces. So far, 1,175 tons of vegetables have been transported to Beijing. Shandong Group continued to increase the shipment of vegetables to Beijing, organizing 6,631 tons of emerging vegetables to be sent in Beijing and put them into the market. Second, we'll continue to do a good job in the festival market supply. First, we'll strengthen market monitoring, timely obtain the supply and the price information to ensure timely replenishment of goods in case of shortage, to ensure market supply and price stability. In particular, point-to-point monitoring and replenishment should be strengthened and increase the frequency of information monitoring feedback. Primary wholesale market, large chain supermarket, and e-commerce platform will continue to pair up with supermarkets and restaurants. And 18 large chain supermarkets will strictly implement their promise not to raise the price of vegetables. Second, will increase the supply source. We'll continue to give play to the role of mechanisms for ensuring supply and demand in neighboring provinces. Departmental and vertical government coordination, collaboration, enterprise linkage mechanisms, wholesale market, large chain supermarket, e-business platforms, directly straight from enterprise to strengthen the leading producer of daily necessities, such as vegetables for Beijing government, enterprise and farmers organization of production and marketing, docking, increased intensity of source organization and dispatching, increase business inventories, and the market supply source. Third, we will enrich market supply during the festival. According to the characteristics of the festival, we will guide enterprises to organize the supply of zongzi and other festival goods to ensure that the market is sufficient and with various varieties. Commercial businesses are encouraged to carry out online marketing activities to provide more supply to citizens in consumption. And third, we'll make every effort to prevent and control the epidemic. For each district, they should carry out responsibility of prevention control. We'll take into account the characteristics of the festival and new guidelines on epidemic prevention control, and follow the requirements of no gathering, no dinner parties, wearing masks, temperature measurement, 1 meter line, frequent ventilation, passenger flow restriction, etc. We should disinfect key parts of public places such as elevator, underground, garage, toilet, and marketplaces, supermarkets, restaurants, and take-out food outlets. They must strengthen their staff health management and check the health kit and increase the booking and reservation of the restaurant areas. We must increase management of the internet famous restaurants and do a good work on the passenger or consumer flow restrictions. Enterprises must be guided to exercise the flow restrictions. Offline promotion work must be suspended. We should stop or control the activities that may lead to a gathering of people offline. We must set up an alert system to promptly handle relevant emergencies and carry out supervision and inspection to ensure that measures of prevention, control, and stabilize supplies and price are in place. Finally, I wish everyone a healthy and a safe, happy holiday. Thank you very much. Now it's Q&A time. Please identify yourself before raising questions. From Beijing Broadcasting Station, I have a question for Pang. The Dragon Boat Festival is approaching. Do you have any recommendations for individuals and organizations for better protection? Thank you. We know that during the Dragon Boat Festival, there is a high chance of big population flow and gathering, and the pressure of prevention control has increased. We must increase our efforts against the epidemic. Now I'd like to make the following suggestions. First, for employers or government institutions and public institutions, they should strictly implement the policy requirement of people living in Beijing and strengthen the registration system and application system and know where they are going. Second, they should do a good educational work and educate the employee not to gather, not to have meal parties, wear masks, and keep social distance and keep good hygiene of hands. And third, they should know the health condition of their employees and urge those who have fever or respiratory symptoms to go to the nearest clinic. And when the case is found, they should cooperate with investigations and implement all response measures. Fourth, during the festival, they should arrange special personnel for the prevention control. Second, for epidemic prevention and control at public places, we should enhance the control measures at farm produce markets, cleaning and disinfection, especially the quarantine and inspection and environmental disinfection of raw and fresh food. Communities should exercise strict measurement of temperature and cold checking, especially the health kit, and check whether the handphone information corresponds with the person himself. And third, all public places, sports and parks and fitness centers should conduct reservation and flow control, check the cold and temperature, and prevent gathering. They should arrange people to do inspection and urge people to wear masks and keep distancing. Fourth, we should not organize promotion work at shopping malls or open cultural and entertainment and underground fitness centers and swimming pools. For the retail service and hotels and markets, they should increase disinfection on the buttons of lifts and handrails and handles of doors and other places that may be touched by a lot of people. 6, for public transport departments, they should increase personnel on peak lines and ask passengers to stagger the peak and conduct diversion of flow, and strictly ban overloading. 7th, relevant law enforcement and competent department should strengthen supervision on food safety and countryside tour and village tour, as well as the environmental sanitation and epidemic control. For personnel protection, we remind you to have a relaxed mentality, but you should increase your personal protection, not to gather, not to have dinner together. Wear masks when you're out, and keep hand hygiene and social distancing, and decrease unnecessary travel. People in medium and high risk communities and people who have links with the place of outbreak should not go to public places. And people at home for quarantine should do a good work on family control and prevention measures. And people should not go outside Beijing unless highly necessary, and not to visit families and tour outside Beijing. For those who must go to Beijing, they must present the NET test certificate. And when you have symptoms, you must go to the nearest clinic, fever clinic, and avoid go to various kinds of public places. 5th, when you go out, dine out, you must select clean restaurants and avoid eating raw food. 6, should have a thorough cleaning of refrigerators, kitchen, and toilets, and keep ventilation of your home. Thank you. Beijing 交通 Traffic TV. What are the atypical symptoms of the coronavirus and how to protect against it? The main symptoms of the COVID-19 is fever and cough, but in our clinic diagnostic and treatment, we found typical symptoms. For example, of the 256 cases in Ditang Hospital, 238 people have fever, or 93%. 92 have a cough, or 36%. 88 feeling tired, or 34%. Coughing with the other symptoms, 61 or 24%. Sore throat, 60 people, 23%. Diarrhea, 36% or 14%. Changes in smelling, 33 people, 13%. And tasting ability change, 21 people or 8%. Now the case increase has flattened from the development of symptoms to being hospitalized. The average is 3 days. It means that when you discover the case early, then you can be treated early. For those people who have close contacts or who have been tested positive, when they are tested positive, they are confirmed on the same day, so the efficiency has increased sharply. According to the statistics, most of the cases have fever. Some are mild, some are high. For asymptomatic virus carriers, maybe they are still in the latent period. and they have developed symptoms after being taken to hospital. And some have very mild symptoms. The image of the lung has not changed, and some of them only have a sore throat and feel tired, and a small number of people develop diarrhea and have changes in their smelling and tasting ability. So we recommend people to go to the nearest clinic when you have fever and respiratory diseases symptoms. For the diarrhea, please go to the clinic and tell your doctor the address, the place you have been to in the past 2 weeks, and the suspected people that you have had contact with. And the doctors should ask about epidemiological history and the history of contacting with suspected people. For the asymptomatic or atypical symptoms of the people in high risk areas, they should go to the to see the doctor promptly. We are still looking into the cases, and there are some questions unanswered, but so long as we implement the relevant requirement of epidemic control, develop good hygiene, wear a mask, wash hands frequently, no gathering, frequent ventilation, we can win the battle against the virus. One last question.我是来自布隆伯格的记者，我有3个问题。北京将会采取哪一些预防性的措施来防止第2波疫情的蔓延？那么这些预防性的措施将会持续多长时间？这些措施将对国际旅行产生什么样的影响？因为我们知道中国已经逐步的向一些国家开放了国际旅行。谢谢。I'd like to invite Mr. Li Haicao, DG of the Municipal Health Commission, to answer your question. Thank you for your question. Since the outbreak of Xinfadi on June the 11th, we have taken science-based, precision-based, and effective measures on prevention and control. We have taken proactive measures to prevent the spread of the virus. We have adjusted the life of urban life of citizens. For key areas and key points, stronger measures have been taken against the virus. In the past 13 days, these measures have produced more and more positive results. I have already briefed you. On the 10th of June, we have found 1, and on the 12th, 6, for 13th and 14th, 36 cases every day. And after that, although the curve are falling, it has been kept at 20 cases. In the past 3 to 5 days, the number of cases have dropped significantly. Yesterday, there were only 7 cases reported. Yesterday, 13 cases. And the day before, only 9. All these are very positive signals. This shows that our prevention and community control measures have been effective. So, going forward in our epidemic control work, we will continue to, based on level 2 of emergency health response, organize our epidemic control and prevention accordingly. Now, we are still at a critical juncture of epidemic control work. Although things are improving and the outbreak is being brought under control, but we should not lose our alert. We should investigate into what are the loopholes, what are the problems, and where are room for improvement. Now, the Disciplinary Inspection Commission personnel have briefed you about organizations and individuals who have not performed their duty well during the epidemic control work. And these are the specific measures we are taking. In general, at level 2, public health emergency response, we must develop a closely knit network of control to implement more strictly the prevention measures. We have made 15 requirements. For different industries and departments, they have their own implementing rules which are more detailed. I'd like to brief you about the following points. Maybe you can find that in the analysis of the confirmed cases, the beef and the lamb selling area of Xinfadi market are the epicenter. Now it is closed. And from the day of its closure, we are not reaching a cycle of epidemic prevention and control. That is 14 days. So we have to first conduct strict closed management of the Xinfadi market and the surrounding neighborhood communities. In disinfection and the cleanup is going on at Xinfadi market. And this work will continue. Second, in terms of early detection, treatment, reporting, and diagnosis, we must conduct a large-scale NAT. In the past 10 days, the speed of NAT has made rapid progress. The capacity of the NAT in Beijing has been increased fast. In early June, 98 institutions provide NAT. Yesterday, the number increased to 133. Every day, NAT daily sample number, not the number of people, because we can use mixed testing method. With regard to sample, it increased from 100,000 on the 18th to 300,000. And this is an increase by 3 times. Under the guidance of the National Health Commission, we have mobilized people from the labs from other provinces to help our local personnel in labs to do testing, to increase the number of facilities of testing, to increase our ability to meet the needs of screening for a large number of population. With regard to the channel of discovery of cases, we can find that through large-scale NAT, before the cases have developed clinical symptoms, they have been found. And this is very effective in preventing or cutting the transmission routes. And we will continue with this method. In recent days, we have gradually, with regard to key sectors, key areas, and key groups of people, conduct NAT screening, and people have taken active part in the NAT community sampling. And the weather is hot, but the result has been satisfactory. Large-scale screening include people working in Xinfadi market or people who have been to Xinfadi market, and people who live in communities with confirmed cases, and people related to areas with confirmed cases or areas tested positive environmentally, as well as people working in farm markets and canteens of employers, and people in medium and high-risk areas. We have released information on which communities are in high, medium, or low risks. For medium to high-risk communities, people are organized to take NAT. For other key sectors and population groups, the screening will continue. We also pay a lot of attention to environmental assessment and analysis. We have collecting a large number of environmental samples. If the sample is safe, it will put people at ease and support their daily life. If there is a problem, then we will do good disinfection and other epidemic prevention control work. For the sub-districts of medium and high risk level and people related to Xinfadi market, they are not allowed to leave Beijing, so that the cases will concentrate in Beijing without being spread to other regions outside Beijing or other places in Beijing. We'll try our best to do that. We also suggest the people in other places not to leave Beijing unless highly necessary, and if they need to leave Beijing, they must produce a certificate of NAT showing that they are tested negative. Fourth, we are conducting close management of communities, such as temperature measurement, code check and registration, and the mask wearing, etc. And before I enter this building, the people asked me to show them the green code of Beijing Health Kit. It shows that these measures are being implemented smoothly at all organizations. Communities of sub-districts at medium and high level should be put under strict management. And fifth, we should do a good communication and education on health. I'd like to emphasize that in this war against virus, everyone should take up the primary responsibility for self-protection. If you take healthy way of daily life, you will help decrease the ratio of infection. So we'll do better work on that. Madam Peng Xinhuo and I are actually envoys of health tips. We have made on a number of occasions health tips to the public at different places. We hope that in this way we will help people increase good health and prevent bad behavior in terms of health. We advise you to wear masks scientifically and wash hands frequently. Do not gather, and keep good ventilation of your home and indoor, and implement all necessary measures of personal protection. With regard to specific measures on prevention control, we will, in accordance with the epidemiological study and environmental sampling, as well as confirmed cases, distribution, and their circumstances, as well as overseas epidemic situation, conduct surveys and analysis and make adjustments accordingly. This is a dynamic course. This is my answer. Thank you very much. We will conclude this Q&A. The press conference is released by various kinds of media such as Beijing Daily, Beijing People's Government, Information Office, Qianlong Network, 首都之窗, Xinjing Daily, Beijing Youth Daily, Tingting FM, Beijing Time, and People.com, Xinhua News Agency, Beijing Channel, CCTV, and China Daily, and China.com.cn, Beijing BTV, and the live broadcasting is conducted by BTV. Thank you all. I'd like to thank all the media from the press and all the working staff. Thank you very much.